Hello, I am Dr. Venkataram Mysore, Dermatologist, hair transplant surgeon, Venkat Center for Aesthetic Health, Vanashankari, Vijayanagar, Cunningham Road, Bengaluru. One of the most common things that people get scared in India, white patches. They become crestfallen, they become very sad, dejected. People often cry and people think that they will be shunned by the societies. This disease is what is called Leucoderma or vitiligo, and it manifests with white patches in different parts of the body, as you can see in this photograph. This disease is associated with a great amount of stigma, ignorance and misconceptions, and with the result that the patients, instead of getting sympathy, empathy, support, they often receive contempt, disdain and rejection. And I am going to talk about this disease, vitiligo, because 25th June is World Vitiligo Day. Now, vitiligo is a disease in which pigment-producing cells called melanocytes get destroyed by an autoimmune process. The immune process, which we all have as a defense mechanism against infections, goes wrong here, and the process starts attacking its own cells, melanocytes in this case, leading to their destruction. So, in our skin, which is brown skin, when the pigment is lost, it becomes white and it stands out. And once the pigment is lost, that patchy appearance makes the patient be subjected to lot of scrutiny. People stare at them, people ask questions. Until recently, there were not adequate treatments. Most of them were not getting treated properly, and so it had the reputation that it was not a curable disease, and people used to be afraid. Such women would not get married, men would also not get married, entire family used to suffer. Added to this, in our Indian tradition, it used to be called Shwitra Kushta. Kushta meant leprosy, and leprosy had a lot of stigma. So as a result, this disease also got a lot of stigma. But I want to tell you, I want to assure you, I want to educate you that it is a curable condition in many patients. There are multiple types of treatment. It is not one type of disease. There are 3-4 types of disease. One type of disease in which it occurs on the hairy areas of the body, chest, abdomen, arms, upper arms, legs, thighs. As you can see here, this is called Vitiligo Vulgaris. Then you have what is called segmental disease, segmental vitiligo, in which case it occurs along a nerve segment like this, as you can see here. This spreads only along a nerve, not elsewhere. These two types of vitiligo, they respond very well to treatment. The third type of disease is what is called acral vitiligo. Tips of fingers, toes, tips of lips. This type is the one which is slow to respond. Another belief is that this is hereditary. It is hereditary in about 20 to 25% of patients. But the remaining 75 to 80, it is not hereditary. It can come to anybody. It is not contagious. It doesn't spread from person to person. It is not related to food. People think if you eat sour foods, this comes. If you eat fish, this disease can come. No, there is no proof for all that. And there are recently very good treatments for this. Treatments are of 3 types: drugs, machines, surgery. Drugs, there have been multiple types of drugs. Sorolens was a type of drug. We control the immunity by giving what is called weekly pulse steroid. We use other types of drugs called azathioprine. There are non-steroidal drugs like tacrolimus. There are certain plant products called polypodium which control the immunity. And there are vitamin supplements, iron supplements, kaolin, phenylalanine. So there are multiple types of drugs for it. And recently we have had a major advance in the management, and that is a drug called tofacitinib. This drug, a new drug called JAK inhibitor, is making a major difference in the treatment of these patients. Even cases which were difficult to treat can be treated with this particular drug. Treatment takes few months, sometimes 6 months to 1 year, and generally these drugs are showing very good results. The next type of treatment is with machines. Phototherapy, photochemotherapy, excimer light, excimer laser, these are all the new machines that we are using. You can see the photographs here. The phototherapy can be whole body, as you can see here. The machine can be only for the hand and foot, as you can see here. A handheld machine which patient can use at home, as you can see here. These are phototherapy machines. Likewise, we have targeted phototherapy devices. You can see here. These are small machines with a cable, and then the light falls selected areas and only that area gets exposed to the ultraviolet light. These are all using ultraviolet light narrowband UVB 311 nanometers. We also have machines called PUA machines, UVA machines 360 nanometers. So these are one type of machines. Then we have laser, excimer laser, which can also be used. All these machines with the drugs that I have mentioned work well when the vitiligo occurs in a hairy area. When it occurs on a non-hairy area like a palm, the treatment is slow. When the response to machines and drugs is not good enough, then we use surgery. We can do grafting of different types. You can see the results here. We can either take a graft itself and put it on the area, or we do what is called cellular grafting. Take a small piece of skin, process it in the laboratory to get a suspension of melanocytes and keratinocytes and apply it. So a small area is enough to cover a large area in this method, and you can see the fantastic result that the patient has. But surgery is done when vitiligo becomes stable. That means for 6 months there should be no new lesion, no activity, no spread in the number or in the size of lesions. Then you can do surgery. So with all these methods, it is possible to give good results in a significant number of patients. And in a small number where we cannot give results, camouflage, tattooing, certain types of creams to apply can also be used to hide the lesion. So with these measures, now we are able to treat 60, 70, 80% of patients satisfactorily, and this new class of drugs called JAK inhibitors is an exciting field. More and more drugs are coming. More research is happening to the culture of melanocytes, more research is happening into stem cells, and I am sure in the next 5 to 10 years, we should be able to cure every single patient. So the final message is in this: there is no reason for unhappiness, sadness, despondency, dejection or disappointment. This disease is as treatable as any disease, but you must contact a trained dermatologist for treating this, not a quack. And you must have patience to take the proper treatment, and the family, the society at large needs to support them. They should not be shunned, they should not be rejected, they should not be subject to any kind of disaggregation or separation. They have to be treated with a lot of empathy, sympathy and support. So 25th June is Vitiligo Day. Let us treat them with support and sympathy and make them aware of all these treatments that are available. Thank you very much. And I have to say here that all the treatments that I have mentioned, every single treatment is available at Venkat Center for Aesthetic Health, and we have been treating these for decades. I got trained in vitiligo surgery way back in 1986. We were one of the first ones in India to introduce the targeted phototherapy. We have 2 whole body machines, 2 hand and foot machines, 2 targeted phototherapy machines, and do all types of surgery. Recently, even we can take melanocytes from hair, extract them and use them for grafting. So such advances are also available at Venkat Center for Aesthetic Health. If you need help, contact us. I hope you have liked this video. Thank you very much.